We're not Italian, like, at all. Can you tell?
Yeah, right? We will be holding a pasta making class after this.
Yes.
Thank you for the warm introduction. My name is Nick Cheetany. I'm with Causal IQ. My colleague, Natalie Busacca, and I are going to be talking about something that really should be on the minds of everybody in this room today, as much as we continue to spend in pharmaceutical advertising. After we talk about the state of the industry and all of the challenges that we have due to the regulations in our ability to effectively target condition-based audiences, we're going to talk about a solution that we brought to the table, and we encourage you to talk to us afterwards. This is in conjunction with our dear friends and partners, our data partners, Branch Lab. I want to point out our colleagues and friends, Isaiah and Mallory. So getting right into it, we really do find ourselves in a very interesting time as pharmaceutical marketers. We all know we are one of two countries in the world that can advertise for pharma. And last year alone, we spent over $17 billion in pharmaceutical advertising, and that's only going to continue to go up. In 2025, it's forecasted that we are going to eclipse $19 billion in advertising spend just in pharma. What is directly proportional to that increase is the increase in regulations. We have built this industry to be HIPAA compliant as we look to target the right consumers in the industry. But that's no longer enough, as states are coming up with their own laws to more safeguard consumer privacy and patient privacy. All you have to do is Google My Health, My Data to begin to understand what those regulations look like. It started in the state of Washington, and states are following suit. What this means to all of us in this room is, as we increase our pharma spending in advertising, we have to be mindful of all of the challenges that we are going to come up against targeting the right consumers. As an industry today, that $17 billion spend that I talked about, that we spent last year on advertising, at best, 20% of your budgets reached the intended audience. For us to be able to accommodate the HIPAA regulations, we have to dilute audiences so much. Now, in the past 2-3 years, there have been some new solutions and new advances in the way that we identify and target on a condition base at scale. But keep in mind that that only accommodates and is able to work around HIPAA compliances. So with this new My Health, My Data regulations that are coming out state by state, what we have currently in the industry does not solve for that until today. So in partnership with our data partners at Branch Lab, we've put together a solution that allows you as pharma marketers to be able to accurately identify your condition-based audiences at scale, and to do it in a way that future-proofs your advertising as regulations continue to increase, both from a federal and state level. How do we do this? Well, we have to remove the ID-based approach, right? So what our friends at Branch Lab have done, Branch Lab is a data science company developing advanced AI software It enables healthcare brands to reach their target consumer and even HCP audiences. This data is fully anonymized and accessed in a clean room environment. The data looks at the touch points throughout the consumer health journey. So we're looking at pharmacy claims, we're looking at specialty pharmacy claims, we're looking at medical claims, we're looking at electronic health records, we're looking at all kinds of sources to be able to procure these audiences, and then we are never appending those audiences to individual IDs, and we are placing them in a clean room. From there, those audiences are activated via the Causal solution. Causal IQ is a demand-side platform aggregator. So we have seats on the 5 largest DSPs in the industry. And that's just a vehicle for us to be able to get your ads across any channel to the intended audience. So I'm going to turn it over to Nat, who will expand a little bit more on the Causal solution powered by Branch.
Yeah. Thanks, Nick. I swear I'm not just here to stand up here. So what we do over at Causal is we actually leverage a multivariate optimization approach, short-term MVO. And what I loved about this solution is we're going to look at not only the positive predictors of what is telling us why a consumer is going to convert, but also the negative predictors. So we're going to weed out any type of waste, which I think, Bill, you said it perfectly yesterday. We have to stop in our industry with so much waste for our clients. And so we're going to look at those negative predictors that are making up these consumers, and that's going to tell us why these patients are not converting as well. So further bringing down any type of waste for our clients, both HCP and DTC. And then we're going to get into Ripple, which is also one of my favorite things about Causal IQ as well, but I'll let you take that over, Nick.
Absolutely. So what Nat framed up essentially takes what I've framed up to be the best and cleanest and most regulated data sources that exist in the industry today, that is idealist, and then powers it in a way that allows Causal to identify patients and their caregivers, and we'll get to that in a second, that demonstrate the highest probability of engagement with the ad and of conversion based on that engagement, anywhere along the funnel, across any type of channel in the programmatic landscape. That provides incrementality in performance. But you have a lot of niche audiences in the healthcare space, both from the consumer side and from the HCP side. One of the things that we are able to deploy is something that we like to call Ripple. It's not an acronym, it's just a name that we made up for a solution that looks at devices that are in close proximity consistently with the intended users. Essentially caregivers, right? And what we have discovered is that by not only presenting your pharma ad to the intended user, who is the patient, but if we present the ads to their caregivers, the probability of the intended user to actually convert and basically do what the intention of the ad campaign is, increases. That probability increases. From an HCP standpoint, it doesn't put us in a position where we are only limited to targeting the NPIs, but we can look at the overall care team and not just looking at the physician or the caregiver, but looking at their colleagues. So their nurses, their nurse practitioners, their physician's assistant, so on and so forth.
And
ultimately,
I was going to say, one other thing, the way that we look at this is our prospecting tool. So a lot of times, campaigns, that is a completely separate campaign that an agency or a brand might be running. So what we're now doing is not only providing that incremental reach, but we're prospecting at the same time, which is massive. I tend to be the rare disease girl in Causal, and a lot of my clients, they're very limited because it's a rare disease. So once we start going after those caregivers, you're actually increasing your audience for your campaign that you're running. So sorry to interrupt.
No, absolutely. We are talking about this not in theory. This is something that we've implemented and put in practice. There has been a lot of PR over the last couple of weeks, not just with Branch Lab's revolutionary data, but the alignment with Branch Lab to be able to most effectively activate these audiences, not just to reach the intended audience, but to make sure that the intended audience actually follows through with what the objective of the campaign is. So passing it back to Nat, we're going to look at a very, very quick case study to just validate what it is that we presented. And then that's it for us up on the stage. We encourage you to find us or find our friends at Branch Lab to learn more about how you as pharma advertisers and marketers, again, can future-proof yourself against the rise in regulation while making sure that you continue to increase performance.
So this was actually for a diabetic campaign. So a manufacturer came to us. They wanted to run a campaign for their flagship diabetic medication. And it was built around not only brand awareness, but also a sales lift. So what we did was we utilized our MVO Ripple so that this way we're providing, again, that incremental reach while also prospecting. And the one call out that I want to make, because brand awareness came down to 17% measured by Nielsen, but we drove a sales lift of 2.1% in a matched market test where we went after users in similar geos against a controlled group. And so that's exactly what we're talking about here today is going after these conditions while not just being HIPAA compliant, but also going in what's required for those state regulations as well. So this is just an example of that. And that's it.
That's all we have. Thank you.